I practice rural medicine, and when I say rural medicine, I don't mean, maybe there's a housing development down the street and that's where I get all of my patients from. Some of my patients walk a couple miles to my clinic. They might not have running water, and they might not have cell phone service, so telehealth is not an option at that. My nurse and I have actually went to somebody's house and drawn blood just so we could get them treated for hepatitis. Back in the day, a specialist used a medication called interferon to treat it, and it had a lot of side effects, made patients sick, was very difficult to monitor and follow. I think a lot of providers in primary care just kind of ignored hepatitis C because they couldn't treat it, had to be treated by a specialist. But the new DAAs, which are direct-acting antivirals, which are the medications that we use to treat hepatitis, have pretty much no side effects. And you can be cured of hepatitis within 8 to 12 weeks.
West Virginia has the highest rate of hepatitis C new infections of any state in the United States. So we needed a way to train more providers in order to treat hepatitis C and especially treat patients within their own communities.
It's either just let a disease stagnate and don't do anything about it, or you have to actually learn and adjust your practices to their needs.
Our office is the data support or infrastructure for what's called the West Virginia Hepatitis Academic Mentoring Program, or West Virginia HAMP. HAMP is a way of training rural healthcare providers to become more comfortable and more knowledgeable about treating Hep C.
Whenever the primary care providers are ready to treat a patient, they can go online, complete the forms, and submit those to the specialists who receive a notification that there's a new consult for them to review. They can go in on their own time as well and provide support back to the primary care providers.
Practicing in rural West Virginia can be quite challenging because for some of these patients, I might be the only provider that they see for years.
Generally, these patients would have to travel hours to Charleston, Huntington, Morgantown, Martinsburg, those more populated areas of the state, to receive treatment like this. Instead, they can receive this specialized care right at home with their primary care providers, and that's a big benefit to the patients.
It's a 8-hour training. We train the providers how to use the system, get them comfortable with completing the online forms. We also provide a lot of one-on-one support to help the providers get set up with their accounts and so on. And any reporting support that they need later on, we help with that as well.
We just want to make sure that we're there for as much support as we can provide so that they can best provide care to the patients that they serve in their communities.
At this point with the program, we've trained 202 primary care and addiction care providers to treat hepatitis C around the state, and this program has reached, at this point, a 99% cure rate for hepatitis C.
If people in primary care knew, hey, I manage diabetes, I manage hypertension, but I could cure this patient's hepatitis C just in a matter of a few weeks very safely. I think that if we had more awareness of that, we could get more people to treat.